Hello everyone, I am Dr. Tejinder Singh. I am a senior medical oncologist practicing in Apollo Hospital, Navi, Mumbai. Today I will be talking about the causes of lung cancer. In the recent past, we are seeing a good number of patients who are females. So it was always thought that lung cancer is predominantly seen in the males, not females. And one of the reasons why we thought that the males are having more number of lung cancer is because of a very known causative factor, that is smoking. So what is happening in lung cancer is that the trend is slightly shifting towards females. Around 20 to 30% patients we are seeing are females. Talking about the causes of lung cancer, the most common cause is smoking or tobacco related things, mainly the tobacco smoking only. So smoking is either, there's nothing called good smoking or bad smoking. There's not something called as adequate smoking or inadequate smoking. If you do less smoking, then the probability of lung cancer is less. But yes, smoking has been found that even if you do smoking once or twice a day also, it is sufficient, and it increases the risk of getting a lung cancer. So there's a common myth which is there, is that every person who is a smoker will ultimately get lung cancer, or every lung cancer patient has got a lung cancer smoking history. So there's nothing like that. There's nothing like that. Every smoker will get lung cancer, or every lung cancer patient is a smoker. So, but yes, it's a proven thing that person who do smoke, as compared to normal population, the probability of getting lung cancer is on the higher side. When you smoke and when you also take alcohol, it causes a synergistic action. Synergistic action in the sense that it increases the possibility of getting a mouth cancer also and lung cancer. Apart from smoking, the other common factors which are causing lung cancer incidence is your genetic issues, then exposure to a chemical called asbestos, which is not nowadays used commonly, but there are asbestos sheets. Asbestos sheets were very commonly used in the rural area, and also asbestos sheet used to be used as a partition. So that can also lead on to increased risk of lung cancer. Radon exposure, X-rays also cause radiation exposure, and certain chemicals. These chemicals can be anything, but these are the factors which cause lung cancer. Recent past, we have seen a lot of improvement which has happened in the lung cancer treatment. We have now so much new drugs available, and we use a word called personalized therapy, where the treatment is based on the tissue which we take it out from the cancer cells, and we subject it to something known as mutation testing from the DNA of this particular cancer cells, and we try to find what is called as mutations, and based on the mutation we try to get the medicines or the tablets available. It has shown a very improvement in the way we see the survival of our patient. Immunotherapy is one more area where the lung cancer patient have seen a very good improved outcome, and the side effect profile of these personalized medicine and the immunotherapy has been very less. So that's the reason why it has become very popular, and in treatment also it's the first line without side effect, with very good target effect. These have brought a major breakthrough in the treatment of lung cancer. Thank you everyone.